Hello everyone, my name is Tiffany Holloway and today I'll be doing my presentation on cerebral palsy, or as many people know it as CP. Many people often wonder what CP is and what it does or what it means. Cerebral palsy is clinically known as a group of disorders that affects movement and muscle tone or posture. It is caused by damage that occurs to the immature brain as it develops, most often before birth. As many of us know, the brain is a very crucial part to our body, and if anything happens to it, it can cause complications or disruptions, which is kind of what this does. Cerebral palsy is the most known disability in childhood, and it affects 2 to 2.5 children born per 1,000 children born in the United States on a daily basis. Cerebral means of the brain, and palsy means complications of muscle movement, which is how cerebral palsy got its name. There are 3 types of CP. The first type of CP is ataxic CP, and this affects coordination and balance. So, as you see in this little picture, this boy is falling over, and that's most patients with ataxic CP. This is what happens. They can't keep their balance and they're always falling over. The next one is athoid CP. Athoid CP it causes tremors or involuntary muscle movement and spasms. So that's what happened to this little boy. He felt like he's having involuntary muscle movement and he's having spasms. So this is this athoid CP. And spastic CP is stiffness of the muscles. So in this picture, this woman is trying to stretch out this CP patient, which is what can help the most spastic CP patients to feel better, because their muscles just want to be stiff all the time and they really need to be stretched out. Treatment for CP. CP cannot be cured, but treatment plans for CP can reduce the severity of this disability. There are many treatment plans that parents can choose their children to go through or ask them if they want to do it. A few of these are tone management, motion analysis, orthopedic surgery, orthotics, assistive devices, therapies, and rehabilitation service that are offered to patients that have CP. One cool treatment plan that I found for CP patients is called hippotherapy. Hippotherapy is where CP patients get on a horse, and by doing this, it's kind of like the patients are channeling the movement of the horses. This can develop the CP patients neurologically, but it also can affect them physically, spiritually, and mentally, because if a child rides a horse, it can probably boost their spirits, because a lot of CP patients are down because they can't do what other students can do. So riding horses has been been proven to be a big treatment plan that can help patients with CP. As you see in this picture, this little boy has a walker and he's about to get on a horse. CP is not just limited to one cause. There are a bunch of causes for CP. And as you can see, this picture has most of the very important ones: infections during pregnancy, stroke either in the womb or after birth, untreated jaundice, which is like a yellowing and liquid around the eyes, genetic disorders, medical problems during pregnancy. But there are also a lot more causes that can cause a patient to be born with CP or develop it, such as bleeding into the brain or infections during childbirth and traumatic head injuries. It is not hard to decipher between a person with CP and a person without CP. If you want to be able to tell if somebody has cerebral palsy, they will have exaggerated reflexes, floppy or rigid limbs and involuntary motions, difficulty walking and difficulty with bodily movements, muscle rigidity, permanent shortening of muscle or physical deformities, problems with coordination, stiff muscles, overactive reflexes and involuntary movements, muscle weakness, muscle spasms or paralysis of one side of the body, failure to thrive, learning disabilities, slow growth, speech delay in the child, speech disorder or stuttering or hearing loss, constipation or leaking of urine, or difficulty swallowing or drooling, or teeth grinding. And this is a lot of signs and symptoms and characteristics to look for if you want to know if somebody has CP. And also seizures, tremors, or difficulty raising the foot. So there are 5 types of classifications of CP: monoplegia, which affects one limb of the body; triplegia, which affects 3 limbs of the body; hemiplegia, which affects one half of the body, either the right or the left; diplegia, which affects the lower half of the body or the upper half of the body; and then quadriplegia, which affects all 4 limbs of the body. So, Brockport Assessments. It is important to assess students just to see how far they've came in a class or to determine their present level of performance. So, Brockport assessments that I found that were acceptable for patients with CP include the 20-meter pacer, the 40-meter push walk, skin fold measurement, sums of triceps and calves, wheelchair ramp test, modified curl up, dumbbell press, seated push up, back saver sit and reach, and the shoulder stretch. And these can all be used for patients with CP. So, sport opportunities for people with CP include Special Olympics and Paralympics. And the Special Olympics is very important for those all with disabilities to come together and just have fun, not really a major competition. And then the Paralympics mirrors the real Olympics, so people with CP can live out their dream like other people without CP can. And adaptations for sports. You can adapt all sorts of sports for patients with CP. So basketball, all students, you can let them use seats or make them walk. So they don't run. So patients with CP can keep up. For bowling, you can use a ramp and allow patients who are in a wheelchair to push it down. For volleyball, you could do seated volleyball, and for softball, you could shorten the distance between bases. There are a lot of adaptations for people with CP. Thank you.